Hello, this is Dr. Do again. This video is on alphabetic list of problems, still on letter G. Today I'm going to talk about the gastric ulcer and gastric cancer. So it's still quite common, probably not as common as probably two decades ago, especially in some underdeveloped countries. It's quite common, gastric cancer and gastric ulcer. But nowadays, there's a new theory, new discovery of the H. pylori, so that is another risk factor for either gastric ulcer or gastric cancer. So is there any associated problem need to visit the emergency? Yes, acute gastric ulcer, either perforation, associated with acute perforation, or the ulcer is deep and invasion of the blood vessels cause the bleeding, vomiting blood. So that is the emergency. Of course, the cancer also can cause this kind of bleeding. Is one of the most dangerous and really warrant emergency visit. So these are, and also cancer also can cause perforation. So basically, for this emergency situation, either the cancer or the ulcer invasion of the blood vessels cause acute bleeding, or through the wall causing the perforation. So these are the acute, life-threatening emergency situation. Or there's some other associated, it depends on the location. So these are the most common and most serious complications that warrant emergency visit. Is any condition associated with the gastric ulcer or gastric cancer that you can manage at home? Probably not. Has to be managed. Even though for gastric ulcer, for example, you probably can use some over-counter medication, H2 blocker, but still need to be managed under the supervision from medical professionals, your doctors in the primary care or the specialist. But you have to has to be managed by the physician. Of course, sometimes even there's some over-the-counter medications, but still need prescribed medications. So having said this emergency situation or managing at home, and then what is the risk for gastric ulcer? And what are the characteristics for this gastric ulcer? So peptic ulcers refer to the gastric ulcer, and duodenal ulcer. They are similar but different. So for example, the location of the pain, gastric ulcer usually at the upper middle gastric area, and duodenum probably at the right, a little upper or right upper or right abdominal. And also in terms of the time associated with the food, usually the gastric ulcer occurred associated with food intake, so right after the meal, and the duodenal ulcer also usually probably 2 or 3 hours with empty stomach, and that's when the duodenal ulcer start to feel the pain. In terms of other like nausea, vomiting, regurgitate, these are similar between gastric ulcer and duodenal ulcer. So what are the risk factors for gastric ulcer? First of all, chronic gastritis is one of the risks. Undergoing long-term damage to the mucous membrane, and then deeper and deeper cause this ulcer. It's just like from the erosion to the ulcer, from the shallow to the deep. So that's the so put this way, gastritis is probably just erosion of the mucous membrane, and gastric ulcer is the I'll put this way, gastritis is the abrasion of the mucous membrane in the stomach, and gastric ulcer is the erosion. I think I just try to explain this, but probably a little confusion. So the risk factors, either the food, very irritated food, too much acid, or alcohol, or smoke, or H. pylori, chronic H. pylori infection. Those are all the factors, risk factors for the gastric ulcer. Also, sometimes could be autoimmune, like the chronic autoimmune caused gastritis. If going a long time, can cause the ulcer. So these are the risk factors. In terms of management, it's quite straightforward. If it depends on the cause, if it is from the erosion, then from the irritate food or alcohol or smoke, then you just quit this and manage by the medications prescribed by your physician. Or if it is a H. pylori, also, I think I mentioned before, manage with 3 or 4 medications. But first of all, need to be diagnosed. So usually the diagnosis is either from CAT scan or the X-ray. With the barium swallow, you can see the ulcer quite obvious. And this is the gastric ulcer. There's another special condition called the stress ulcer. Gastric ulcer caused by the stress, either acute injury, trauma, very serious trauma, or long-term of steroid intake can cause this ulcer from stress. So if that's the case, you have to remove the medication and to treat with soothing medication to coating the mucous membrane to protect it. So this is the gastric ulcer. And gastric cancer is really probably, first of all, the first risk factor is the gastric ulcer. If a chronic gastric ulcer for a long time, then the cells around the ulcer undergoing the inflammatory change and transformed into the transfer into the malignant cells, is undergoing change of malignancy, so that start the cancer. Usually, and also the alcohol, the smoking, and genetic, they are all contribute to the gastric cancer. So again, the diagnosis is through either the barium swallow, probably not quite accurate. Usually use the scope and take the biopsy, send to the pathology, look at the cells under the microscope to diagnose whether it is a cancer or it is just inflammation. So this is, in terms of the management of gastric cancer, I think the surgical, if it is early stage, definitely is the gastrectomy or radiation, chemotherapy, 5FU, etc. So this is, but the taking home message is you need to know the signs, or for the gastric ulcer or cancer. Usually for the cancer, probably start from asymptomatic, or just like the ulcer, the symptoms similar as the gastric ulcer, but since it's going for a while, then changing to the cancer. So just the follow-up, regardless if we have consistent epigastric pain, regurgitate, nausea, and also GERD. So this kind of problem, get it checked from your physician and discuss and follow up regularly and follow complying with the management. For example, the 4 or 3 medication regime is kind of difficult to follow, but it's really radical treatment for the H. pylori, and also decrease the risk for the gastric ulcer and the gastric cancer. So I'm going to stop here. Hope it helps, and thank you for watching. I will see you next time.